Hi, I'd like to introduce Andrea. Andrea, maybe you can tell us a little bit about yourself and why we're sitting here today.
All right, my name is Andrea, and I met Mike as an instructor when we took an arthrokinetic course for massage therapy, and I've had shin splints since about 4th grade, and then discovered in 97, between 97 and 2000, that it wasn't actually shin splints and it was compartment syndrome, and then I had surgery, and I've been dealing with the aftermath of that with nerve damage and what have you, and then your techniques for bone bending, or whatever you want to call it.
Sure. Can you tell us a little bit about how that led up to having compartment syndrome?
Apparently I was born with it, but it presented as shin splints starting in elementary school when I was playing soccer, and then it resurfaced again with playing badminton and marching in cadets with the heavy impact on the boots. And then when I was 18, I enlisted in the Army, and when I was on basic training, we went through PT every day, which was excruciating, and I had to ice my legs every day. And then on a 16K rucksack march, I went past pain to the point where I could not feel anything from my knees down, and I hit the ground, and I did that twice. And then when we got back to barracks, they let me go because they had buddied me back the last couple of kilometers, and I made them let me go because I'm a little stubborn. And then when we were dismissed on the march, I guess I blacked out and I hit the ground. And when I woke up, I had a couple of my platoon mates holding me down, because when they had first tried to rouse me, I hit somebody, which I don't remember, but he did. And then they took my boots off, and my legs were black and blue and swollen from the knees to the ankles, and then I didn't walk for 2 days. So I was released from the Army, and then it took 3 years of physiotherapy and consultations with different doctors to figure out that I had compartment syndrome.
Okay. Well, that would be quite an event for you to go through.
Yeah.
Yeah. So since that time, you had your physiotherapy, and then eventually led to the surgery. And tell us about the surgery.
The surgery was, it was actually fascinating. They went in, and it was at the University of Calgary Sports Medical Center, and Dr. Matadi was my surgeon. And he said that when they went in and they actually cut the fascia, he almost couldn't cut it fast enough because the resting pressure in my muscle compartments was so great that it mushroomed the muscle through the fascia, and he almost couldn't cut fast enough, and he was afraid it was going to tear. So I had a considerable recovery time, and I chose to do both legs at the same time so that I only had one recovery period. But it was a night and day change for the fact that I could now, step outside and actually go for a quick jog, or I could walk up the stairs or run up the stairs without pain, or sit on the kitchen counter and jump down and not buckle because I had pain reverberating up my shins.
Okay.
So, yeah.
Okay, so then you had the surgery and things were better.
Mm-hmm.
Tell us about when I met you, and then what you were feeling at that time in your shins.
Okay. You and I met, I think it was around 2010-ish, and my surgery had been in 2000. So in that time, I had complete recovery from my surgery, but because they had to lift a nerve in the front of each shin to go behind the shin, like behind the tibia, there was nerve damage where the entire branch of the nerve had been pulled up. So I have nerve damage and tingling across the tops of both arches. So I've dealt with that since the surgery. And so I still have considerable tenderness and sensitivity, and some days I can't wear socks because it fires all the time, and it shoots tingling and weirdness up my shins. Flip-flops are a nightmare in the summertime. I have to be very specific with how they cross my foot, or I can't wear them. So then when I met you, and you were teaching us about the periosteum on the bone and how it can actually tighten up fascially, the fascia over the muscles, and then torsioning that to release everything, it was quite fascinating. And then of course I cried on the table when it worked. So
yes, it was quite some time. I believe it was in November of 2011 in Red Deer.
Okay.
And I asked for volunteers for anyone that was having any lower extremity or lower limb pain. And your friend, Janet basically volunteered you.
Yes.
And at that time, I remember saying it was very sensitive on the tibia. So then, anyways, we got you on the table, and maybe you can just describe what that technique was that I performed with you.
It was I don't remember what the name of it was, but it was like tibial torsion or something. So you stabilized the joint above and below the knee, so that there was no actual movement with the knee itself, and then you took my foot and actually put so much pressure on it that it, like, hence the bone bending. And you can feel the deep and intense stretch because you're not taking it through the muscle. You're actually you're sort of avoiding the way the foot normally moves with the muscle, and you're going sideways. So it was fascinating because you can feel the deep inner pull, which is something I'd never felt before. And as soon as you released it, I remember feeling the flush of like blood flow and the heat. And then Janet came and she ran her thumb up my shin, and she's never quite gentle. She was never gentle. She's a very deep massage therapist. But she ran her thumb up my shin, and it didn't hurt me at all, and that's when I cried. So, yeah. And then we did the other leg, and I was super happy.
I remember saying, well, if it was a 2-day course, and I said, well, let's leave it till tomorrow. If you're still pain-free tomorrow, then we'll do the other side.
Yeah.
Yeah, and then the next day came, and I asked you, and you just pointed to the other side and said, go
Let's
ahead.
get her done. Yeah.
Yeah. So that was great. So in principle, it's called end range loading technique,
Okay.
and you can apply that to bones, tendons, ligaments, and even nerves. The principle is to try and get the edema, the built up edema, out of that tissue. And in your case, it could have been edema built up in the periosteum or on the tibia. So we did a bone bending in about 3 different placements to try and get the exchange of fluid between the periosteum and the interstitium. And so we did that procedure, and it seemed to be favorable with you anyways.
That's fantastic.
And how long did that last, after we did that?
Oh gosh, it was so long ago. I would say I was probably pain-free for at least 3 months.
3 months.
Yeah, which has never happened, like before that or since then. So, unfortunately, you live out here and I'm in Alberta, so I can't really pop in every 3 months
Yes.
for a refresher. But yeah, it was
Okay.
at least 3 months.
Sorry to interrupt.
Sorry.
So, and today, how was it feeling today?
They're tender. I mean,
Yeah.
it doesn't really, that part doesn't really change. Like if I just run my fingers up my shin, it's tender.
Yeah.
So, yeah, and if I run into something,
Yeah.
like if you knock your shin or something on a coffee table, it's
painful.
try not to speak for a few seconds because
The pain.
it's rough.
Now, you were RMT as well, registered massage therapist in Alberta. And have you tried any of these techniques or that technique on any of the patients that you've had?
I did more on the upper extremities with clients who I had a lot of oil field workers and rig boys that were on the drilling floor, so they're constantly pulling and pushing on heavy equipment, so their forearms were super, super tight, and they absolutely loved it. But I don't remember actually doing any lower extremities. It was all upper.
Okay. So the question for you today is, would you like to try this procedure again?
Absolutely.
Yeah. Okay. So she's come all the way from Alberta to sit with the interview. We're in the Greater Vancouver area in Tsawwassen, British Columbia, and so this is a great opportunity for. Would you like to go by Dreefy?
Yes.
Dreefy, to have another procedure done. So would you like to proceed?
Absolutely.
Okay, great.
Sure.